I'm very pleased to know that we've managed to get contact with North Carolina, because as I mentioned last night, it was very difficult to pin, well, to even be able to share the presentations. And I know that Joy is using a hotspot at the moment, so I'm not quite sure what the state is in regard to her own technologies or her own broadband. And Chrissa, I haven't actually heard from you. I hope that you are here. I understood that worst came to worst, you were going to connect with your mobile phone, but I will leave you both to introduce your project, which is a collaboration between the University of California and the AKT Development Corporation and Bear River Land Holdings. Over to you, Joy.
Thanks, Ian. Can everybody hear me?
Can absolutely hear you.
Great. I'm going to leave my video off because I am through a hotspot. We are actually in California, so thanks to Ian for putting us last on the program because it's still quite early in the morning here. And we had a huge storm, and it's still ongoing, so that's led to a number of power outages, internet outages, etc. So I'm still working through a hotspot, and I'll apologize in advance for any technical issues. And I do see that Chrissa is also here.
I'm on, yes.
Hi, Chrissa, and I believe she was going to speak first and introduce the project, so I will turn it over to you.
Thank you, Joy, and thank you, Ian, for including us in this wonderful, wonderful event. All of the speakers that we have seen have been very, very interesting. My name is Chrissa Demos. I live in Sacramento, California. I work for a very large land development corporation, and we do mostly greenfield development, which is the building of new communities and cities. So we don't build the houses, we actually do all of the planning and all of the infrastructure. And so home builders come in and build new homes. And we are delighted to be working with UC Davis, especially Dr. Melnico's team, to really figure out from a community perspective, not just the homes being retrofitted with new gadgets, but how can we develop an entire community that helps people age safely, more affordably, and more, happier, have more enjoyment out of their lives, and not think that, oh, I'm just going to a Gulf Sun City and that's where I'm retiring. Really, we've seen the largest sector of our population, or one of the largest sectors, if not the largest, is the over 100 age group demographic. I also wanted to give mention to something that I believe her name was Sheila before. I apologize, I'm just participating by phone. Said before about bringing in the special needs community. Our project started along with Dr. Luvis Mara, who's participating on this call. He's not a speaker, but he is listening. In building a community for those on the autism spectrum to be integrated in typically developing communities. And Dr. Vismara had the insight of being able to integrate people with special needs into senior communities because they share a lot of the same needs. So that was very much the seed of our project. We've been working with Dr. Melnico and other researchers at UC Davis Health to really understand what research exists on healthy aging communities, not just the homes, not just the gadgets that will be a part of our community, but the urban planning side. How wide should the sidewalks be? Should they be wide enough so that two people in wheelchairs or walkers can walk instead of one having to move for the other? Making sure that there are handlebars at crosswalks, so as people need to get up on a curb, they have assistance. Where should we place mailboxes? Where should we place community centers, convenience stores? All of these different questions. And it is my honor and my pleasure to introduce Dr. Joy Melnick, who's going to speak clearly on that. But again, thank you all for including us in this wonderful conference. We look forward to continuing to participate with the Agile Aging Alliance, AAA, and the ISO. Thank you for including us today. Joy, take it away.
Thank you, Krista. I'll just start by introducing myself a little bit. I'm a professor at the University of California, Davis, and I direct the Center for Healthcare Policy and Research. Our mission is to do research and inform policy to improve health. And this project fits very squarely in that mission. Next slide, please. So why is this important? I think we've probably iterated on this multiple times, but I'll just talk about it a bit more locally in California. You can see here the projections from 2010 to 2060 in our the age distribution of our population and the number of people in each of these older age groups, and the very rapid growth of people, especially in the 65 to 74 age group that will be happening over the next 10 years, as well as the 75 to 84 age group. And it's also projected that people turning 65 are going to live another almost 24 years, including 4.5 of those years with one or more limitations in their activities of daily living. So that's really important to take into account when we're thinking about community design. Next slide. So I'll talk about two, oh, we skipped a slide there, I think, but that's okay. I don't know what happened. I'll talk about two projects that we are working on at UC Davis today. Healthy Aging in a Digital World, which is a broad transdisciplinary program dedicated to appropriate use of technology to optimize health and social physical function as we age. And that's a project that is led by Dr. Tom Nesbitt and Dr. Heather Young. Next slide, please. And as we've heard about earlier today, there are a number of ways that technology can bring healthcare into the home. And Healthy Aging in a Digital World is specifically working to improve and increase the use of these kinds of technologies to empower residents to engage in preventive health behaviors, use sensors to track potential problems, use communication technologies to facilitate social connection and telehealth. And in this world of COVID-19, that's become more and more important, the use of telehealth, use of cameras and infrared thermometers that can allow for more remote care with objective data, and built-in support for the activities of daily living, rehabilitation, continence care, considerations of ensuring that people are staying hydrated. Next slide, please. And then the second project that I'll talk in more depth about is related to this partnership between UC Davis and Bear River Land Holdings on the design of this community for health and independence. And in this case, we're starting out from empty land. So it's quite different from many of the projects we've heard about earlier today, at least that I was able to listen to, because the first part of the conference was extremely early in the morning in California. So starting with empty land, we want to think about land use planning and design of a multi-generational, age-friendly community that can be inclusive of persons with intellectual and developmental disabilities. And to date, we've worked on two preliminary pieces for that partnership. The first was a report in 2018 where our center looked at the potential benefits and barriers to initiating this partnership. And I'll go into more details about what was in that report. And then the second piece is an evidence summary that we're currently conducting to synthesize existing evidence about research evidence and descriptions of model communities to inform land use planning and design. And that report is in process. Next slide, please. So in 2018, our report summarized what the university leadership needed to consider in terms of the potential benefits and challenges of such a partnership. We looked at the regional demographics and the projections for those demographics in terms of why such a partnership might be important. We did a brief overview of model communities that we could identify that had some similar features to what we were considering. We did a rapid review of the existing research, and we sought input from university faculty on what they saw as the potential challenges and opportunities of such a partnership. In looking at how the partnership could really contribute to the university mission of research, education, community engagement, and healthcare delivery. Next slide, please. So in terms of the community models, gee, I think we skipped a slide here as well. Nope, we didn't. That's okay, go back to the community models. Nope, community models, please. Next slide. You can see here we looked at sort of three major features of those models, and I believe at least a couple of those models may have come up in the conversations today. We looked at communities that incorporated technology in their in the community to support older adults. We looked at communities that focused on the built environment and how that built environment could support older adults. And two of these communities, Lantern and Hajwe, are communities that are designed for people with dementia. And then finally, we looked at public-private partnership communities, usually partnerships between community developers or community people running the communities and universities. So Mirabella, for example, is a retirement high-rise community in Portland, Oregon. That's a collaboration between the developer and now the administrator of this community, as well as the Oregon Health Sciences University. And all of the dwellings in that high-rise are equipped with a number of technological features that residents can choose to activate if they so desire. Another interesting public-private partnership is Judson Manor, which is a partnership between Case Western University and the School of the Arts with a retirement community. Where the students live in the community and participate in musical and other performances for the residents of that community. And that's enriching the environment of that community through the work that the students provide. Next slide, please. In our evidence scan in 2018, we looked at three elements. We looked at smart home technology, and we found that a number of studies assessed the accuracy and acceptance of technology, like did it measure what it was supposed to and would people use it? But we really found very little evidence about whether the incorporation of these technologies actually improved healthcare outcomes or had beneficial effects on healthcare utilization. There was very limited research that indicated that technology might help to sustain aging in place, and it might reduce caregiver burnout. So there's definitely a gap there and a need for more work. In terms of the built environment and design, we found considerable evidence that built environment and environmental design can improve and enhance physical activity. And common positive interventions related to works to improve neighborhood walkability, adding pedestrian-friendly features and providing access to places people wanted to go, destinations, services, and recreation. So if people could get there by walking, they were more likely to walk. And then finally, there was some evidence for community-based services and programs, interventions to improve functioning and independence and reduce depression and social isolation. So the idea that not just the design of the community, but also what happens in the community once people are there can be very important in terms of the quality of people's lives and improving their functioning and independence. Next slide, please. So in 2018, in general, the conclusion was that the opportunities outweighed the challenges, and the university has gone ahead in establishing this partnership. We found that there was, in terms of research, a potential foundation through the partnership for very groundbreaking longitudinal research on healthy aging and age-friendly communities. Many opportunities for education for our health professional students and perhaps other graduate and undergraduate students in terms of practicums and other projects where students could help to support and contribute to the community and also improve their own training experience. The challenges here for research were the need to have a durable partnership that would include a partnership beyond the development phase when people are actually living in the community. And in terms of education, the logistics of oversight of training and supervision. There were many, many opportunities that we saw for community service, and that could potentially intersect with research in terms of trying to develop an evidence-based model with services to support healthy aging that could be replicated in other places. And then finally, considering healthcare delivery, smart homes with telehealth services could create connections for care to our UC health system or other providers. And again, very important, increasingly important in our era of COVID-19. And then the possibility to consider on-site health services in the community where people could access care without having to travel. Finally, a challenge there, and I think this challenge has already come up several times today, concerns about privacy and resident concerns about particularly the use of technology with regards to privacy and how to address those, and the need in terms of on-site services to have sufficient patient volumes to make it financially sustainable. Next slide, please. So the current report that we're working on is really focused on land use planning and design characteristics and features to promote age-friendly communities. Next slide, please. So one piece of that report is a review of evidence and best practices. We are conducting, in the process of conducting a rapid literature review to look for both peer-reviewed and gray literature to address our key questions, which relate to transportation infrastructure. As Krista referred to, even sidewalk design can be very important in considering building a community from the ground up. The layout and the sizes of residential dwellings ranging from, more affordable, sometimes smaller dwellings to multi-generational homes that can accommodate larger families. Additional structures and community layout, where do the retail facilities, community facilities, and other kinds of facilities that would promote community interaction and physical activity, how do those get laid out to optimize the community function? Thinking about third space, which people in this audience probably already know, relates to a place where people go to gather in some post-COVID world that is neither where they live or where they work. Thinking about making sure there's adequate green space, gardens, and the possibility of water features, community facilities, recreational facilities, and technology infrastructure considerations. So what's needed in the land use planning process and the initial infrastructure to ensure that technology can be supported into the future. And so evidence and best practices for these things are scattered about, and we're doing a lot of work to gather this information together as we can find it. Next slide, please. We're also doing key informant interviews to learn more from a variety of people, including the kinds of people on this call, architects, land use planners, and aging experts, to try to identify best practices and model communities, considering existing communities, also known as blue zones, where people seem to have improved longevity, communities that support intellectual and developmental disabilities, and what are the considerations for developing those kinds of communities, and then looking for planned intentional communities to support healthy aging. We're identifying and reviewing these model communities as we talk with our key informants, profiling in particular their land use and built environment features, as well as technology infrastructure needs, healthcare facilities, and research facilities that may exist in these communities. Next slide, please. So what are gaps that we've come across so far? Really the need for more longitudinal, comparative, and observational evaluations of these communities and community design features. So does providing the innovative technology that we've heard quite a bit about today, does that really improve health outcomes, and what works best? So we need more evidence about that. Does it help with caregiver satisfaction, and what features in particular best support those outcomes? Second, what key features of community design in suburban and rural areas? We're really talking about sort of greenfield development here and not urban planning so much. What are the key features of those kinds of communities to improve health outcome and quality of life for older adults and individuals with disabilities? And this is an area that seems to be rather sparse, both in the gray literature and the peer-reviewed literature. And then finally, what sorts of infrastructure are needed to support community, home, and personal technology for age-friendly developments in these suburban greenfield areas that are a different challenge from the urban development or redevelopment. Next slide, please. So what are our next steps? We expect our current report to be completed by the end of March, and we're continuing to work with our partners at Bear River to inform the land use planning process. We look forward to continuing to collaborate with the Agile Aging Alliance Research and Development Team to share evidence and best practices on land use and housing for design of age-friendly communities. And we plan to participate in this international network of emerging neighborhood developments to inform the creation of standards for the ISO standard for smart multi-generational neighborhoods. And I'll just add that I think the standards may need to take into consideration the type of community where these neighborhoods exist, so more suburban, more urban. And then final slide, please. So here's our contact information for anyone who has thoughts or questions. We look forward to hearing from you. I'm sure there are a number of model communities that I've not mentioned in this very quick talk, and I appreciate you're all staying with us at what is quite a late hour in UK time. Thank you.
Thank you both very much. That was fascinating. And it's great to be on the early stages of this journey with you. I note that Mac is still with us, and given that you are the driver, if you like, for our Shapes pilot project, did you have any thoughts or questions, observations that you'd like to share with Joy?
Oh, thank you, Ian and Joy. That was really fascinating. I mean, I have a whole lot, but I don't want to monopolize the time. I suppose just from a very pragmatic basis, you know, if we were to try something like this, Joy, within Ireland, or indeed in a number of countries across Europe, of course, one of the questions is, how do you get municipalities on board, and how do you get funding on board, and how do you get funding from such different perspectives that you're trying to address? Perhaps in California, that's easier to do, or maybe it isn't.
I think this is probably a question that Krista may want to address primarily, because that's really the next step. The land use, there's a whole number of regulatory processes that have to be carried out to get to the point of actually starting a community like this. And the first one is getting approval for the land use plan. So that's really where we're starting. And Krista, I don't know if you want to add anything to that, if you're still on the conference. Maybe not.
I think she may be there. She was having some problems unmuting herself before. So are you there? If you want to put your hand up, we might be able to help you, Krista. In the interim, let me just, whilst maybe Krista is, oh, she has got her hand up. Yeah.
Yep. I think I unmuted. Okay, sorry. I got kicked off. So in respect to everybody's time, and to answer that very, very important question, when we do go through our process, it is a very regulated process. We have to deal with federal authorities, state authorities, local authorities, and municipalities. And on top of that, several different codes that go into this. And what often happens is we continue to do our processes as we always have, and we come out with beautiful communities. People want to live in them. But working with Joy is allowing us to shift our perspective in an evidence-based way to allow for some changes that still work within the legal frameworks that we have to abide by, but create a better environment for the people that live in the community.
Does that mean that if you take this in incremental steps and you get the evidence working with UC Davis, that you can then think about scaling this? Because I know that the development is massive in the first instance, but you are developing it out in stages. And how does this apply to other developments that your company is interested in?
We want it to be a template, not just for our company, but for all of the developers in California and effectively the nation and the world. We want this to be the first of its kind and a template that other developers can copy and improve upon as we go forward. So we're starting with one phase, and as the phases go, we hope to be able to implement things that we have learned from prior phases. But we hope that all of this becomes public. All of our documents in our business are public. So all of the land use plans will be public. We hope the study is public, and we hope to inspire other developers who are concerned about healthy aging to have these resources and build upon them.
Paul Quinn, is that something that you'd like to comment on from a developer's perspective in Europe?
Yeah, I think actually, first thing to say, that's really welcome to hear that approach, Chris. So that's great to hear. Second thing to say is, I'm incredibly jealous of the of the opportunity you have and the project you're working on. It just sounds magnificent. I thought one of the things that struck me was one of the points that Joy picked up earlier. We've spent quite a lot of the day, particularly this afternoon, quite a few sessions we were looking at the role of technology in the home. and the fact that there's this research gap in how, obviously the assumption is that that allows you to live a safer, longer life in your own home, and as you alluded to, sort of support carers in doing that. But if I picked it up correctly, you're suggesting there's actually not much research carried out to confirm that, to date anyway.
I think that's correct. At least published in the peer-reviewed literature, which of course doesn't tell us what's ongoing, but what's been published. Mostly what we're able to find were a lot of papers saying, yes, we tried this and people used it. Or, we tried it and people liked it. But it doesn't really tell us much about whether these hoped for health outcomes actually occur. And that's the kind of research we could do in some of these communities where this technology is being implemented. If it's, and it's much easier to do this kind of work if you think about it at the beginning, rather than waiting until you've got everything sort of up and running. And then you're like, oh, wouldn't it be great to study this? Because then, of course, it's much more complicated to figure out how to conduct that kind of research.
Can I ask you, Joy, did you hear the session a little earlier from the local authorities, the regional government here in the UK, where they have been exploring the use of enabling digital technologies, and they are translating that into socio-economic references, KPIs in effect? Is that the kind of thing that's relevant to what you're talking about? And would it be complementary to your work, or are you very specifically focusing on your own development in terms of creating that research?
It is, it's really important, and it's also very compelling for justifications for this kind of, for the kind of work of incorporating technology or other kinds of home adaptations, or designing home adaptations as we're building. And to be able to say that this has the potential with a small investment to save a lot of money, I think is very important. It's also really important to sort of follow through on that and see, okay, now we did this, and what did we find? Did we actually manage to get these technologies and other adaptations installed in a timely way that people didn't have to go to a retirement home or a nursing home? So being able to actually document the outcomes that occurred that we're projecting, I think, is also really important. And so both pieces are complementary.
And you might be interested in helping to consolidate that know-how, because obviously, these are examples of far-sighted regional authorities that are doing something. They too would like to see that evidence recognized so that they can go back to government and internally for more. So the higher we can push this up, the better, the more centralized it becomes in terms of, the know-how, the better as well.
Absolutely. And I think the more evidence, basically the key point for trying to do this research and develop this evidence base is to be able to support the value of what we're doing for healthy aging, right? And then as a side to convince investors, government, whomever will be supporting it, that it's worthwhile. So both those things, I think, are very important.
Do you have any takeaways that you would like to leave with the community? Obviously, well, not obviously, you weren't here at the beginning, but we are going to be creating a report off the back of this to see, where we go, next steps towards the creation of the standard. So are there any real takeaways that you would like to share with us?
Well, I think I would, and our team and our partnership would love to be collaborators in developing this evidence. So if other people have been working on this process of conducting various kinds of research on outcomes or on costs, we would love to collaborate on that. And I think it's the more that we can work together and collaborate, the stronger will be the evidence base that we develop.
Thank you. And Krista, do you have anything to add to that from a
no, just to echo Joy's, I heard a little bit of the Wolverhampton speech, as well as Joy mentioned. It was quite early for us here, and we also have no power, and it's been one of those days. But really understanding what the municipalities are doing, that's very, very important, because it allows us to point to things that are working already, even if they're smaller scale. Paul, I wish I could lure you to California under the pretense of beautiful weather, but unfortunately that's not going to work today. But we'd still love to have you. Bring your raincoat. We're very much looking to build a human-centric template. Instead of, going through our normal process, which begins with drainage and begins with all of the other legal parameters that we have to focus on, we are really working towards being able to replicate a human-centric model throughout the state and hopefully the nation, and hopefully after this meeting, the world. So thank you for all that. But really, the municipalities are very important.
Well, I think that they will be very keen to further participate. And some of those that you missed have got some great presentations, which we'll share with you as well. Paul, can I turn to you? I think you've been putting together some notes to try and summarize this rather rich pie that we've baked today.
Yes, I'll not delay people too long. Just a couple of things struck me during the day. First of all, how amazing it is that we've still got 60 people on the call, given we've been at it now for 7.5 hours without a break, and people have really stayed with us. So we're very appreciative of that. It's also been fascinating to watch the ebb and flow of participants as we move around the globe from east to west through the day, and heard all those incredible case studies and all the links and all the research that people have attached in the chat box. The chat box alone is worth the price of admission, I think, today. It's been, it's full, it's very rich material. And I think, Ian, you and I will be picking over this for several weeks to come to pull it together into something that is practical and usable, which I think has been the sort of core of the day. It's easy to get lost in the great challenge of demographic change, but actually everyone on the call today have been bringing clear minds, clear ideas, real options for how we can address change and how we can embrace it as an opportunity. So it's been such an interesting day, and my sincere thanks to all the speakers and also to all the participants. Everyone's contributed, and we're going to enjoy unpicking it all and pulling it all together, and we'd love to distribute it then as widely as possible after this.
Thank you. So I think that probably wraps it up. It has been quite a long day, and I want to thank Nell in particular, who after presenting has been doing the hard work of working with the slides. And the reason for this is because of circumstances like nearly hurricanes in California, which means that the technology, the broadband, isn't necessarily going to work. So we have to do it all centrally. And so I received an email first thing this morning. What time are the breaks? What breaks? So Nell, amazing, well done. I'm glad you survived to tell the tale. And Paul and Clarion, thank you very much for your support. Thank you all for participating attending and contributing. We're planning to do something of a similar nature in May, and we will be in touch before then. So without further ado, I wish you either a good morning or from this end of the world, a good night. Thank you.